Well, hello. This is training session number 2. We're going to dedicate it solely to telehealth, or telemedicine as many people call it. In my opinion, telehealth is absolutely the most exciting benefit we package. It's the most important benefit to most of your clients because it is the benefit that will affect their bottom line the most. So let's get into it. One of the reasons telemedicine is going to be so important, or telehealth, is that we have a shortage of primary care physicians, and it's only going to get worse because there's a lot more people entering the systems. And what's happening, we see a few ends of the spectrum here. One is, you think about a self-funded company in particular, but any company in general, you've got individuals who, if they can't easily get in to see a doctor or they don't know where to go, they ignore symptoms, delay treatment. It leads to more serious medical complications. They're literally a ticking time bomb. On the other end of the spectrum, you've got Sally, who's got an allergy, same allergy she had, last year. She calls the nurse up at her doctor's office to try to get that prescription, and they tell her, no, Sally, you've got to come in and see the doctor. So she leaves work for minor issues. It results in an absent employee, loss of productivity, and unnecessary costs. And then, of course, you have people who get sick on the weekends or at night, or their kids get sick, and what do? They go to the only open door, urgent care centers or ER centers, which cost a lot of money. So I think what we're all aware of, what we're going to see in the next few years to come, is we're going to see overcrowded medical offices, probably a lot more nurse practitioners and physician's assistants. We're going to see walk-in clinics and kiosks popping up in every grocery and pharmacy in the country. We're going to continue to see an overuse of urgent care and ER clinics at night and on weekends. But what we'll also begin to see is one of the fastest growing segments of the healthcare delivery system, which is telehealth or telemedicine, doctors who are available by phone or secure email. And they're going to be what we used to call gatekeepers are now called navigators. They're going to be the new navigators and patient advocates. The reason is people who have minor health conditions and don't know where to go now have somebody where they have immediate access to health care, to any individual, wherever they are, whenever they need it. And that doctor can either treat them or refer them or tell them where they have to go or what they need. So they're the patient advocate as well. And of course, the most efficient and cost-effective way to deliver this service is by phone, because everybody's got a phone. Now, the telemedicine industry has been a growing industry. It's been around for going on about 8 years now. And the National Center for Policy Analysis, which is a big think tank in D.C., wrote a white paper several years back that actually started to take a look at the potential for telemedicine to restructure healthcare where it could solve problems, reduce costs, and improve quality of care. The Center for Health Transformation also said in their white paper it would play an increasingly central role in getting the right care at the right time to individuals, particularly for minor types of conditions. And so there's been a lot of companies and organizations looking at telehealth. The problem, I think, with the business model, the challenge, was that their services required a copay. So there was really a barrier to entry. Companies were trying out telehealth service, but the employee had to pay $35 a call, and they just didn't get a lot of usage. Now, that's beginning to improve now where companies are picking up part of the tab, but with our model, we've eliminated the barrier altogether by including the doctor's cost into our program. So for the consumer, there's absolutely no cost whatsoever. So we partner with a network of licensed board-certified physicians that are available in all 50 states, 24 hours a day, 7 days a week, 365 days a year. You can get a hold of them by phone, secure email, bidirectional video right on your computer. They can diagnose and treat non-emergency routine medical conditions, and they can prescribe medications when appropriate. The idea is not to replace your primary care physician, but to have a physician to go to when yours isn't available, or you have a minor condition, or it's after hours, nights or weekends, you're out in the field or on vacation, or you need a refill for your blood pressure medication or whatever, something minor. What we found over the last few years is 94% of the calls that come in are successfully diagnosed and treated right on the phone. I mean, we're talking minor. I'll show you the whole list of things that are treated. But only 6% were told that they couldn't be treated by phone and were referred out. They were told where to go. So once again, patient advocacy. And the satisfaction level with this service was 98%. Probably better than most doctors get on, personal visits. But the other numbers that I think, when you really start to put a pencil to it, which are pretty staggering, is that 64% of the callers would have gone to a physician, and 15% would have gone to an ER had they not gotten a hold of the doctor by phone. So if you start to quantify the amount of time and money that is saved by talking to doctors on the phone, it truly is amazing. Now, who are these physicians? Because a lot of people, we're all skeptical of change. People are skeptical. We've all been brought up to believe that it's going to a doctor's better than talking to one on the phone, but it's really not always the case. All these doctors are, practicing physicians. They have an average of over 10 years in the field in primary care, internal medicine, emergency room practices. They're fully credentialed by the NCQA, which is the same organization that credentials them to work in hospitals. And the conditions they treat, as you can see in this list, are the types of routine conditions that most doctors see 80% of the day. Colds, sore throat, bronchitis, allergies, some infections, headaches, stomach aches, and so on. These have very classical conditions. They're easy to treat, and it's as simple as that. It's as simple as that. The doctor asks the right questions. It's a very conservative approach, actually well-defined and limited scope of services. It's evidence-based and quality improvement oriented. If the symptoms exceed the scope of a telephone call, they refer the patient to the right kind of doctor. And they also maintain personal, electronic health records which meet the requirements that the government wants, in the future, the compatibility with the continuity of care record. So that's important because that means they have cross coverage, and that if you call a doctor tomorrow after speaking to one today, that doctor has all the notes in front of what happened, the day before, of what happened today. So he knows what the doctor spoke about, what drug you were put on. In terms of drugs that are prescribed, just so nobody has to worry about, there's no controlled substances. I mean, this is very limited to, well, you can see the list here, but things for allergies, things for acute illnesses. They're not prescribing controlled drugs. They're not prescribing cosmetic drugs and things like that. So that's, it's well-defined, limited scope. And, what I tell companies is, because they all want to know, what's going to be their ROI on this. And, of course, you can't promise any numbers up front because it really varies according to a number of variables. What package did they choose for their employees? Because, we bundle a number of benefits together. What did they pay for it? Did they pay 100%? How many of their employees are using it? How active are they in implementing the program and making everybody aware? But I can comfortably tell a company that just during their first year, if they get as few as 25% participation, they're going to get more than 125% return on their investment. And, by the second year, the third year, depending how long it takes to ramp a program up and get everybody to start calling first before they run to the doctor, companies can make $2, $3, $4 return for every dollar invested, and essentially reverse, their health care costs. So in my opinion, like I said, telehealth is the game changer. This is what's going to get companies to bite on the hook. All the other benefits are icing on the cake. They're great. They're going to save the employees a lot of money. This is what's going to save the employers money. What we'll talk about next is is our core dental, vision, pharmacy discounts.